I would now like to call Dr. Anand Zachariah to guide us through the theme of this conference.
Each of you has come because of your concern and interest regarding the theme of equity. The developments in medicine, medical education, and healthcare have moved medicine away from the right to health and equity. Today, equity is regarded as separate from mainstream medicine and education. It is not an idea that we think about seriously in clinical medicine in our day to day work of taking care of patients. Equity is regarded as a topic of public health, community medicine, and health systems. So it may appear strange for a department of medicine of a medical college to be organizing a conference on the theme of clinical approaches to addressing health disparities. The separation of the practice of clinical medicine and equity is indeed the reason for and the purpose of this conference. The conference has three main purposes. The first is to create a discussion and conversation about equity in mainstream medicine. Equity as an idea and concept should be part of and permeate our work in clinical medicine, teaching, research, and advocacy. It should be part of the language we speak and implicit in our actions. The second purpose of this meeting is to share experiences practicing equity from across the country. We have invited people who are working towards equity in the community, remote locations, tribal, urban, difficult to reach communities, government, and academic organizations. In the call for abstracts, we have been warmly surprised by the large number of responses, particularly from students and young practitioners and researchers from different backgrounds. And we hope that the conference will facilitate exchange of experiences and views and common learning. The third purpose of the conference is creating a community of people who can work towards equity. The informal conversations that happen around the meeting between old and young, people from different fields, different geographical locations are important. We need discussions across clinical medicine, community health, public health, and the social sciences. There are two shifts that the conference marks. The first is from thinking about equity in healthcare to thinking about equity in health. The second is from community health and public health approaches to addressing equity to equity in the practice of clinical medicine. The conference has different themes, concepts around equity, practice models of equity, urban health, special communities, medical education, non communicable disease care, advocacy, and technology. We have planned the conference as a hybrid event to allow greater participation, but prioritizing the physical participation and in person discussion. As Kripa has already said, the schedule includes invited speakers, torchbearer sessions, the clinical social case discussions, and free paper presentations and posters. The papers and posters include practical experiences, primary research, approaches to teaching primary and secondary care and equity, and viewpoints. And finally, at the end of the day, we have informal discussions in the evening. and we would encourage you to visit the stalls in the quadrangle. The documentation team will be compiling ideas and learnings from each session, and these will be shared on the conference platform on a daily basis. We hope to bring these learnings together in the concluding session, which may help us to think of the agendas to take forward. I would like to conclude by sharing the conference logo with you. It was designed by Kale, an MBBS graduate from Tirunelveli Medical College, travel fellow from the Tribal Health Initiative, now studying MPH in the Sri Chitra Tirunal Institute in Thiruvananthapuram. The idea of the logo is the tree of health, abundant with fruit. Health and life that the earth gives us belongs to all people, young and old, able and disabled. It is in this organic and life giving way that we have to think about equity. We hope that the conference will provide the opportunity for each of you to share what you are doing towards equity, for us to learn from each other and discuss what we can do together to move forward.